So as we all know, thoracic spine, also called as dorsal spine, is between the cervical and lumbar spine. It's in the thoracic, bounded by thoracic cage. So thorax has 12 vertebrae and 12 discs, and any problem around this disc or the bone, we have a lot of issues. So thoracic spine, either it can be a disc problem or it can be a stenosis problem. So disc, as we all know, is in between two bones. When it comes out, we call it as disc prolapse. In thoracic spine, the space for the nerves is very narrow. So as a result of which, a disc comes out, patient will have a devastating problems. At the same time, there is a ligament in the back and covering the spinal cord in thoracic spine. It's called yellow ligament. Often this yellow ligament, either it can get thickened or it can become calcified, leading to thoracic spinal canal narrowing. We call it as thoracic spinal stenosis. So a patient can have a thoracic spine disc prolapse, or he can have a ligament thickening leading to stenosis. So with these two things, patient either can have a severe pain, or he can have a neurological symptoms in the form of weakness of lower limbs, leading to sometimes complete power loss, leading to a paralysis. What are the common symptoms and signs in a patient with thoracic spine issues? So common symptoms, as I said, either it is because of the disc prolapse or it is because of the stenosis. So when a patient has a disc prolapse or stenosis, patient can have two main symptoms. Either one is pain, or he can have a weakness in the lower limbs. So when they say pain, this pain either it can be in the back of the thorax, that is in the mid back, or it can radiate across the rib cage. They say severe pain in the back, and they say it is radiating to the chest. Either it is coming anteriorly, and they say it is very tight constriction like thing around the chest. So this is a very disabling symptom. Either it can be a pain in the back, mid back, or it can be radiating pain around the chest. So the other main symptom of a disc prolapse leading to severe compression of the spinal cord, they have a weakness of lower limbs, or numbness in the lower limbs, or severe paresthesias in the lower limbs. Patients say difficulty in walking, and he has a continuous numbness in the lower limbs. These are the common symptoms when a patient having thoracic spine issues, either because of the disc or because of the stenosis, he can come to a doctor. If it is very severe, then patient can have a paralysis where patient cannot walk, his urine control and motion control completely goes away, and he cannot control. So he can have a urinary incontinence and motion incontinence, and power in the limbs is lost. It is 0/5. So these are the common symptoms a patient can come, which are very devastating, especially in thoracic spine. So how can we diagnose these thoracic spine problems, a patient having spine issues? So these thoracic spine issues, a patient coming with either pain or with a weakness in the lower limbs, patient should not neglect these symptoms. He should immediately visit a doctor or a spine specialist. Once a patient is there, clinical examination is done, we can roughly assess as a doctor whether issue is very severe or it is a mild issue. Depending upon the clinical examination, we can diagnose it accurately with investigations like X-ray or MRI, the thoracic spine, and understand what is the exact problem there, whether it is the disc or whether it is a ligament which is causing thickening and causing compression. So, or else sometime rarely a bone can cause a problem there. So we can clearly understand what is happening there with MRI scan. and diagnose the problem. What non-surgical treatments are available today for thoracic spine problems? Once we clinically examine the patient and do some necessary investigations and diagnose the issue, so we all normally start with patient with medication, some rest and some physical exercises and physiotherapy. Most of the time they get better with these simple measures with exercises and medication and rest and some precautions we tell them to take care of their thoracic spine. If this is getting better, then patient comes back to his routine after a few days. 90% of the time there is no necessary for surgery. They become better with these measures if they come early to a spine specialist. When is a surgical option need to be considered in thoracic spine issues? So the moment, as I said, medical management or conservative management is not working, or the patient is becoming worse even after the conservative or medical management, or the symptoms are very severe or very significant on clinical examination and MRI, he definitely needs surgery, or the spine specialist decides that surgery is the only option, then we need to go for surgery. That is the time it should not be delayed. In cervical spine and lumbar spine, there is some time for the patient to think, but in thoracic spine, when patient symptoms and signs are severe, we cannot wait because the injury is devastating. That's why you need to go for a surgical option without waiting much time. So what are the surgical options available and what are the advancements in thoracic spine? So when you come for surgical options in thorax, because it is bounded by a rib cage, the thoracic spine, so when you want to operate on the patients, we need to do a lot of big surgeries in thoracic spine. We need to cut open, remove the bone, remove the joint, and put lot of screws and so many issues. Even a small issue need to operate in thoracic spine. We need big surgeries. To circumvent this, now we have a technology called endoscopy, where with endoscope spine surgery technologies, these are the latest advancements. We can a 20 centimeter incision with lot of screws and rods, we can prevent that and just do a small 8 millimeter hole and get away without any of these big surgeries. So patient can become better with very small hole, with 8 millimeter incision. With endoscopic spine technology, we can address the disc or we can address the stenosis today with excellent results. How long this endoscopic spine technology option available for this thoracic spine surgery in India? So this technology we were doing endoscopic spine technology we are doing for cervical spine and lumbar spine since a long time. Of late we are even doing it for thoracic spine, and we as Asian Spine Hospital is the pioneers in this endoscopic spine technology in India, where we do excellent with giving excellent results for both thoracic disc disease and thoracic spinal stenosis. We can use this endoscopic spine technology and give the best results, avoiding big incisions, many screws, implants. These all things can be avoided, and big where traumatic surgeries can be avoided today with this endoscopic spine technology. And this is available in India now, and it is being done routinely at Asian Spine Hospital. What can patient expect about the recovery period after his treatment, and how can he prevent further issues in future? So this is very important aspect of treatment. When a We treat patient say two things, conservative and surgical. Conservative management or medical management, patient gets better. He need to be always careful that these symptoms can recur. So he need to do a lot of ergonomic way of working, physical exercises, and take adequate precautions not to get the symptoms again. If we have done surgery to this patient, then again this takes time to time to heal. So he need to take adequate rest and good physical exercises, and again ergonomics at workplace, which can prevent him to again have a recurrence or a problems at a new place. Either surgery or no surgery, patient need to have a disciplined work culture and personal lifestyle where he can avoid getting injured and leading to devastating symptoms like paralysis in future. So always a spine patient should take care of himself, having a holistic approach towards his lifestyle.